when I was doing my medical school, none of us actually had any idea about what psychiatry was and things like that. So first time my own classmate falling ill and he recovering was a big eye-opener for me as far as psychiatry and intervention is concerned. I think if you look at the basic issue of psychiatry was acceptance and stigma. A small kid as old as just 5 to 6 years old can have attention problem which would actually need clinical intervention. So medicines may not be the only answer to a lot of people's problems. So holistic approach involving a lot of other specialists involved here and giving this sort of tailor-made solutions to patients becomes important. In spite of all the best intervention, there's still a significant population of psychiatric illness who really struggle for complete recovery.
Welcome to another episode of Talk of Town podcast, where we are in conversation with entrepreneurs who are very successful and are on their path to achieving fame. So let's make them the Talk of Town. Today's video is sponsored by DAA Capital. They are a boutique investment management company who provide unbiased advice. They will assist you in investing in variety of instruments like equity, mutual funds, bonds and much more. For more information, check out our description and get in touch with them today. Our guest for today is Dr. Mahesh Gowda. He has done his MBBS, DMP at NIMHANS and went on to do his DNB. He is the director and consultant psychiatrist at Spandana. And what is very interesting is he's pursuing his LLB now. Let's hear more from him about his experiences, about the various encounters he has had in his psychiatric career, and about his entrepreneurial pursuits. Dr. Mahesh, welcome to our podcast, Talk of Town. I think my most, question that I want to ask you desperately is why psychiatry? When you started studying, what was the thought process when you chose psychiatry?
If I were to recollect, I think my first chance about psychiatry was my own classmate. When I was doing my medical school, none of us actually had any idea about what psychiatry was and things like that. So under exam pressure and stress, one of my classmates fell unwell. He was so symptomatic and his symptoms were so obvious during his viva, during his theory, he bunked the class and a lot of things happened and none of us could get an understanding of what the behavior was. Within a week's time, I understand that he's so disruptive, he was hospitalized. All of us had gone to visit him at NIMHANS and there I understood that there's an illness. And after I saw a sea of change that happened with his treatment and the outcome that came out of it, I was really impressed. That's my first instance of psychiatry. All that I knew was like a layman. Anybody who was wandering around disheveled and things like that was a psychiatrically ill patient for me.
Okay.
The first time my own classmate falling ill and he recovering was a big eye-opener for me as far as psychiatry and interventions are concerned.
Okay. So that led you to pick a
Yes, that was my first year of school. So that's my first instance of psychiatry.
My goodness. I think, and also when it's a friend, you're more emotionally invested in that
Yes, and
process.
it makes an impact. This is my early days of my medical career. So anything that's really strongly impacts, I think that stays for longer.
Wonderful. And also a very emotional area of study, according to me. Now, you have been in this for probably 20 plus years, 25 years now. So have you seen a shift in the landscape of mental health itself? Like we can see it around us, but I'm sure you're exposed to a larger spectrum of the society. How do you think the landscape has changed? Has it even changed?
I think if you look at the basic issue of psychiatry was acceptance and stigma. If you look at all our seniors working, it was most of it trying to reach the population and trying to create awareness, trying to really say what illness was and how the treatment could actually make a difference. So they've laid really strong foundation over the last 3 to 4 decades. And what we are seeing is people more willing to come forward to take treatment now. Okay. So the awareness is quite high. And if you look at even rural population or urban population, educated versus non-educated, yes, there are some people who are really, traditional in their approach, don't want to accept and stigmatize psychiatry. That's a very small sect of people. But most of them seem understanding, they're more welcoming of a problem whenever it comes to addressing these sort of issues, and they know where to go now. So I think there's a huge shift in the last 3-4 decades. We don't have to really wait for somebody to come and take help. A small sect of people actually shun this sort of labeling of psychiatric illness, and they don't want treatment unless they become severely ill. They really attempt suicide, or they become violent, they become dysfunctional, they disrupt their lives in some way. They don't get the required attention and help. So this is extreme cases. So a lot of people, because of awareness at school level, college level, at family level, a lot of friends, a lot of media doing a lot of work on education of all the psychiatric illnesses, a lot of people are able to pick it up very early. So the earlier the intervention, I see a lot of difference in the outcomes also.
Excellent. So now you are associated with an establishment called Spandana. Can you tell us a little bit about the kind of work that goes on there?
If you look at how this actually started, if you look at the history of psychiatry itself, it is not a very old specialty as such in terms of the organized sector that we have.
Okay.
If you look at the the Department of Psychiatry at NIMHANS itself, they are around 75 years old, and the whole department seems to be doing a lot of organized work for the last 7 to 8 decades now. So in the private sector, this was totally unheard of. So very few people actually venture into private practice and starting their establishment on their own. Our hospital has been there for the last 6 decades, and I'm the second generation psychiatrist here. So they've actually laid strong foundation here in terms of creating infrastructure, creating the bandwidth. So this hospital caters for the the needy people, the lower and middle state of people. We are not so efficient and we're not so cosmetic enough to cater for the higher state of people, but any person who really has a problem, who cannot really afford treatment, can find some sort of solution in our side of hospital setups.
Wonderful. And are there specific areas and specific illnesses that you target at Spandana?
General psychiatric illness, if you were to name simple issues like not being able to sleep well, it could be stress related issues, anxiety related problems, phobia, panic attacks, exam related stress, and school refusals. All those things are very common issues that people come across. Having problem adjusting to severe stress in life, leading on to severe anxiety and panic, or also going on to develop severe depressions. Major psychiatric illness are schizophrenia, bipolar, and you have a host list of addiction related issues that come in: alcohol, nicotine, cannabis, opioids, screen time addiction. So all those things are endless list. So we seem to be catering to general psychiatric issues. We have specialists who come in to consult to specific areas of their specialization when it comes to a second level of consult.
Wonderful. So there is an entire spectrum that one can come in for.
Yeah. From outpatient management to inpatient management to rehabilitation, we seem to have solution to most of the illnesses here.
Superb. Now, just looking at environmental difference, like there's a lot of change in our lifestyles, and obviously that has a direct impact on mental health of people, of different classes. Have you seen a sort of pattern that has emerged based on why they have approached you so far?
I think there's hardly anybody who would not admit that he's not stressed in their life. So if I look at a typical day, a person leaves his home at a designated time, but he does not know when he's going to reach his office. So he has a timeline to follow. He has a lot of work schedules ahead. So just reaching the office on time, or reaching the school on time, or college on time, it seems to be a big hurdle because of the sort of environment that we live in. So stress seems to have caught up every aspect of our lives and every strata of people here. So there's hardly any population or any occupation which seems to be spared of this stress. So it's such a common word. You ask them, are you stressed? They're very easy to accept this sort of word. And stress would have led to multiple issues on their lives. It could be just simple issues like not being able to focus, concentrate, to having a psychiatric illness, to actually not feeling well enough. So the whole list of symptoms can actually emerge over a period of time. So I think there is a lot of symptoms and the stress that they actually have interplay with, and that can depend on his coping strategies. Some people are gifted and they have very excellent coping strategies. They have good personality factors. We call this as resilience factors. So they're able to negotiate, deal with stress and manage them without actually getting too very stressed to go into a breakdown. Some people are not so gifted and they get into a trouble very easily.
And I believe that today you have several diseases that stem out of stress itself.
Correct, yeah.
Right? So I think identifying that is the first step.
Correct.
So having said that, what has changed now? Because I think traffic was there. For that environment, traffic was there. There was exam pressure. There all these situations were still there. What has changed now, and why is it so prevalent and it's affecting us so much? Why? What has changed according to you?
I think if you look at how we grew up as students and things like that, we didn't have internet and we didn't have a host list of problems that the current school and the current college kids are actually facing. I really don't know how I would have actually managed the current level of stresses that these kids have in schooling and learning curriculums. Current day learning system seems to be very different. There seems to be extremely vast. A lot of syllabus are different. And if you look at a lot of the levels of educational understanding and the knowledge that need to achieve, I think what we learned in 10th, I think a 4th standard or 5th standard kid is currently learning. So the syllabus is so different and they're packed with information, and everybody seems to be driven to perform. When I would score 80, it was really good enough. I would get an appreciation for that. Getting 99 is not good enough now in the current generation. The kids are doing extremely well, and if you look at the same marks is shared by so many people. So one mark is actually causing a difference of hundreds of ranks actually. So a lot of strategy goes on to how to differentiate each kid, the level of difficulty in the question that they answer, the age of the child, the sex of the child. A lot of other factors also go into get a mark. So the current day kids are extremely different. They're really put onto the grind. Anybody who seems to be in this sort of profile seems to get the beating here, and it's very tough. I don't think it's very similar. You said that traffic is similar, but I think we've grown 10 times in terms of exponential growth. So a person could easily drive without much skill sets in 30 years back. Now I don't think it's really good enough. If you're really extremely good, then only you can drive in a situation like this. So everything seems to be different and changed, and all of us are driven to perform. We have time constraints. 24 hours doesn't seem to be enough.
Correct.
And you seem to be always on the go, and you have so many things to do in the whole time. And there are also extremes of people who seem to be so organized. They really don't want to go out of the syllabus. They have very limited things that they do. They're happy, satisfied. The satisfaction quotient is very different for everybody. So if somebody keeps their expectations extremely low and stick on to the basic principles of what they need to do, I think a lot of people are comfortable and safe. But most of us do so many things that we don't have a reason and understanding why we do it. And we are really driven to perform, and that creates a lot of trouble to us.
Now, for someone who is not entirely aware, right? Like, how do you identify stress? Like, for example, I have a friend, I know that she's stressed. And when I confront her, she says, no, I'm pretty happy, I feel driven. But I can see from an external standpoint. Now, if you have friends like this, it's okay and you're sort of warning, but then you're going with the grind of life. How do you catch yourself, or how can you address this early on for yourself if you have to self-evaluate?
I think the difficulty here is a lot of us are not open to the idea of being evaluated and being labeled. That's the whole difficulty here. Suppose you were to look at your own life of what happens. So having a good work-life balance is a very idealistic scenario, but not all of us are able to really achieve this. So when we are eroding this sort of work pressures and to our leisures and comforts and spending time with family, I think it really shows up. Sleep is a very important parameter for all of us. Right. People who are able to sleep a good 7 to 8 hours seems to be rebooted and refreshed, and they're able to deal with most of their day's work. But if you don't catch up on sleep, that's when I think your coping mechanisms are really put into challenge. So when you don't sleep well, the level of anxiety can be different, your level of irritation can change, your concentration, focus can change, you may not perform well, so you get pulled up in office. So a lot of things happen with just sleep as an issue itself. What begins as just a sleep disturbance can manifest into anxiety. When people have anxiety of 10 to 20% level or initial stages of anxiety, they're able to manage with whatever they can. They are able to relax themselves, hobbies, they're able to do some exercises and manage meditation. All those things really help. Once it goes beyond a threshold of 25-30%, that when it starts showing up clinically. That's when the diagnosis is possible, and a lot of other interventions like medications and therapeutic interventions really work.
So until then, it cannot be detected?
No, it can be detected when you do structured assessments like scales or doing a focused psychiatric interview. But not all of us are available. So if you were to look at what's happening in your own life, if you're able to sleep well, reboot yourself, I think that's the baseline to say that I am comfortable with what I'm doing. The moment we take up tasks that are very demanding, the moment there are tasks that are extremely challenging to you, that when it's going to challenge your coping mechanisms, your life skills, and your personality factors. When we don't have this sort of skill sets with us and we are taken up something difficult to do, we may be able to step up and manage. People who are not able to adapt, step up and manage also decompensate and go into breakdown and have major illnesses at times.
Got it. I think it boils down to being self-aware and sort of checking on yourself every now and then to keep a tab on this. Now, also with the growth of social media and the amount of content there is a lot of discussions about mental health and all of that. And so I'm guessing as a result, the stigma has gone down. People are probably easily coming and seeking help. But on the flip side, you see the newer generation, the younger generation, using the word anxiety and depression very loosely. So anything happens, in little kids at school are using these words very loosely. So how do we know when it is real? Like when we have children of that age, they're discussing these things. When do we take it seriously? How do we measure it? How can we combat this kind of, usage of words that are actually serious and clinical, but they don't know, or if they are telling, we don't know, maybe they could be saying the truth. So how do we evaluate at this point?
I think technology and social media have a lot of responsibilities and role here. There's abundant information available on the net for anybody to go through and check, and depending on what I want, I can find exactly the sources of material that I would like to read and discuss. Helping the child or a student read the right sort of material is extremely important. These words are used loosely, but I look at it positively to say that the level of awareness has stepped up to know that there's something called anxiety, there's something called depression, there's something called psychological issues that can actually seek help. The sort of work that's happening in the field of mental health is so much that the stress is laid on emotional well-being, being psychologically well enough, having good mental health. All those things is being talked about so well, and this sort of work is needed for them to be aware of. True. If somebody is using it very loosely, it's not really something of our worries and concern here, because I would look at this as awareness. If somebody really has just mild symptoms, it can be easily managed. I don't think everybody needs really sort of evaluations and work. It's actually showing in terms of their marks, grade, the way the child is coping up in school. If the child is not attending classes well, frequent absenteeism, having behavioral issues, if the child is not able to focus well, concentrate well, his grades is falling down, or if he has other related conduct problems at schools and things like that, I think that's when the child gets attention of the teacher and gets attention of parents also. So the extreme cases are very easy to pick. The mild cases don't need to be really evaluated and assessed and treated. So it's the moderate ones that we must really focus on. Having this sort of checklist for symptoms. I may have anxiety, but there may be a lot of checklists that you can actually refer. If you have a checklist of more than 3 or 4, you may need help. Having 1 or 2 may really not have a problem. So it's basically threshold. So I think self-awareness and a lot of online material is available for checklists. So there are a lot of screening tools for anxiety, depression, attention deficit hyperkinetic disorder, substance use and reading to dependence patterns. So there's so many self-rated checklists. So all these things would help you to understand. And there are school counselors, there are college counselors as first-line gatekeepers there. Teachers really are educated enough and they really understand the importance of emotional well-being now. All these people are able to pick up the difficult ones and actually refer them to further evaluation. So I think whatever is happening now is good, but I think using net and information online responsibly is very important. Social media has a very important role in creating awareness and making sure the really needy people get help.
Absolutely. I think I want to ask you another thing regarding students. How early have you seen things manifesting today? Because I think if you see evolution, kids are, what probably we used to do in 8th or 9th, you see kids doing that in 3rd or 4th, it's getting younger. So have you seen psychiatric issues in younger kids as well?
Yeah, if you look at what was there 4 decades back and now, I think the scenario is extremely different. A child who don't concentrate, focus on class, not do homework would be branded as a bad child earlier. Now, the moment the child is not performing well, the teacher is able to pick up these sort of issues and look at the psychological needs of this child. So, a small kid as old as just 5 to 6 years old can have attention problem, which should actually need clinical intervention. So, disruptive kids, having poor attention, not focusing in the class and not reading or learning anything in the class, very poor grades is something very easily noticeable in the school with the current system of evaluations. So we have young kids who have attention and conduct behavioral issues who really come in.
But isn't that how they behave normally?
No, that's I think there's certain expected norms in terms of behavior that you need to do. I can be myself in my home space or in my private space, but when it comes to a structured environment like school, college, learning place, or a hospital, I'm expected to behave in certain way. If the kid cannot really change his mindset and adapt to this thing, this sort of change scenario, I think there could be a problem. See, you may think that child should not be labeled very early and they don't need to take medications, but there are extremely safe, well-tested research medicines which are extremely useful to kids who do well with these sort of interventions. Attention deficit hyperkinetic disorder is so common in kids, and whenever you intervene, the results are extremely good.
Wonderful, wonderful. Just from your experience, can you give us a case study of, probably you working with a child or a student, and how it has benefited them, their treatment and how it has worked?
I was talking about attention deficit related issues. So if you were to look at a typical case here, a child would not sit in a class constantly talking to the neighbor, constantly disturbing the classroom decor, disturbing the teacher at times, even in spite of multiple warnings, multiple threats. Multiple punishment doesn't seem to deter this child at all. He continues to be disruptive. So what the teachers generally do is make him stand outside, make him kneel down. So all these traditional methods of deterring this child also does not seem to be working. He's taken to headmistress. It does not really work. So when they understand it's not happening, and when you actually start intervening in terms of medication, the child could be 5 to 6 years old, but when they start taking medication, they get laser sharp focus. So this child can sit in the class for half an hour to 40 minutes, really focus, start writing down. His handwriting improves, his spelling really improves. His ability to sit down and write an answer to a question really improves. If a child with ADHD is given a question paper for 3 hours to answer, he cannot sit for more than 30 minutes and he just gives up the paper and comes back.
Okay.
The child can sit for 3 hours and finish this paper, his marks is going to be totally different than what he is getting.
Absolutely.
So we have enough success story to say that intervention at this level for an indication like this has shown multiple good results, and teachers have been happy. We got good feedback from the hospital, school administration, parents. Unless you're able to demonstrate this sort of change, no parent is willing to medicate the child and put them on treatment and things like that. So the moment they start seeing the child with these sort of changes, they come very promptly for follow-up. They make sure the child is on medications and everything goes well.
But there is stigma around medication, especially with psychiatry, Like there is this, you don't go to a psychiatrist, they'll give you sleeping pills, that's the common myth.
I agree with you, because it's just not with the lay public and common man. Even with the medical fraternity who are not, so much in touch with psychiatry or intervention psychiatry, first say don't medicate a child. Don't give sleeping pills, don't give psychiatric medications for long, the habit forming addiction. All those things are extremely common. These are all myths. Okay. So if you look at the history of any medication, it would have gone through 2 to 3 decades of research, testing, safety data. Then only it goes to the level of approvals and they get a lot of safety data from the actual patient population.
Okay.
Unless it's approved, I don't have a license to prescribe. So if the government or the regulatory authorities say it's safe to prescribe, why are we questioning this sort of evaluation process? So if it is banned, I cannot prescribe. I get penalized for prescribing something that's banned. Right. So if it is accepted, if it is allowed and licensed to be prescribed, I think it has a place to be used, but we have to use it judiciously. Not everybody needs a pill. So please be selective, use the right doses, use it for the required time, and then I think everything should be all right.
Excellent. Now, let's just shift the focus to addiction. What is addiction? Like in today's world, if we say right now, I think the most common thing that you see is screen. It's not just restricted to children. I think even adults, and if you see some of the older generation, they are always on WhatsApp and they are also looking at screen. So what is the yardstick to define what addiction is?
I think it's a very relevant thing what you talked about screen time, because I don't think anybody is really spared from screen time. This has so much of material to view on WhatsApp and so much on YouTube that every other person seems to be glued onto net, and they have so much material to watch on. So we really don't know what's a safe screen time for somebody to use. If you really were to communicate effectively what you need to communicate for your work and the basic needs, I think 30 to 40 minutes in a day should be really good enough. But we have conversation with friends, family. There's no timing for it.
Yes.
If you look at the sort of reading that you do online, there's tremendous material again to read online. So a lot of people are reading online, communicating online in terms of mails that you're using, WhatsApp, and self-study research that you do. A lot of things are happening on phone and screen time now. So I think based on a person's background, each one could have different needs. But the key and the foundation here is to make sure each one is using responsibly and to the extent that is actually needed, and we really don't get hooked on to it. If somebody is into gaming and if somebody is into addictions online, I think it really takes away the whole fruitful functional hours of our daily schedules, and really it erodes into everything. So a safe screen time for anybody could be 1 to 2 hours time, depending on the background of work that they're doing.
Okay.
I think you can have different yardsticks. But I think we need to look at each individual person, looking at his background, then only we know what's safe for him. The moment is interfering with your normal work functioning relationship, I think that's a warning sign that we must look at. And I think most of the phones tell you exactly how much of screen time you're using on a daily basis, on a weekly basis. So there's a lot of feedback mechanism that can happen. Kids can be allowed to use a screen for a particular number of hours. Net can be controlled. Screen time can be controlled using a lot of apps and things like that. So a lot of protection is available, and helping the child to read and learn and understand the right things online becomes a responsibility of every parent here.
Yeah, so I think non-interference with your day-to-day life is probably the yardstick for everybody here.
Yes, yeah.
Okay. Now, in the society we live in India especially, we have a lot of traditional practices, like you have yoga and you have breath work, which is meditation and all of that. Does that have a massive impact on the healing of mental issues and mental health?
I think all interventions seem to have a place here. If you look at the initial part of psychological distress or difficulties that people face, like it could be just mild anxiety, mild depression, and sleep-related issues. This is a time when a lot of intervention like this can really make a huge difference. Doing yoga, breathing techniques, meditation, pursuing a good hobby, exercising regularly, basic simple walks or running, jogging or cycling, swimming, anything can really have a lot of beneficial value and can actually do a lot of de-stressing work. They're equally effective like medications, at this level of intervention. But once it passes beyond a threshold, that's when I think they have their role here, but you need additional psychological, therapeutic intervention, and also medication would be really important beyond a threshold.
Okay. So actually that you've partly answered what I wanted to ask next. It is that, we go to the gym for our physical fitness. So what can one normal person who has your, day-to-day stress of traffic, of work, of meeting deadlines, what can we all do to keep a check, to keep our mental health in good place, and also to keep a check on yourself? Like, what are some of the tips that you would?
I think if you were to look at most people, we all struggle with managing our time. A typical example could be me trying to do everything at a given day. So I cannot really balance my work. Work is extremely demanding. You go sit at 9 o'clock, I can actually see patients till 9 o'clock in the night and go back, and I actually hardly have any time to do it. This was my pretty much schedule for long, at least 15 to 16 years of life. And this is so stressful and difficult. We all tend to decompensate in some way and get into trouble. I've made a lot of modifications just to make sure I should be an example, because I cannot talk and preach something that actually I don't believe in. So I start work late now. I make sure I give 1 hour of time to my own well-being in terms of physical activity. Some days could be walking, some days could be running. I spend some time with the gym, at least 2 to 3 days in a week. So every day I have some activity which could be different to make sure it really works. So any form of physical activity is good because it is able to de-stress you and manage a lot of things. You're able to have energy, focus, and that sort of emotional well-being and energy is something that you get when you do a lot of physical activity. So you can choose. A lot of people do cycling and swimming, depending on your own liking and the sort of inclination that you have to pick up something. So the biggest asset could be your physical health, and something that can guarantee good physical health is exercises. So you can choose whatever form it really suits your needs, but you must invest in a good hobby, and exercises becomes a part of your physical needs in terms of well-being.
So Dr. Mahesh, this is a personal question from my end. You see people with mental illness and psychiatric concerns on a day-to-day basis for the last 2 decades. Doesn't it affect you? How do you maintain your mental health?
I think it's a very important question. What happens is throughout your period of training from the medical school to even doing psychiatry as a specialization, I think you've been exposed to all these sort of issues. So from morning till evening, you listen to people's distress and difficulties.
Yeah.
There's hardly anybody who comes and talks about what's good about their life. So this is a typical thing of what happens in work. But I think you will develop a shield to understand. You have to empathize a person with distress, at the same time hold yourself back and not get too emotionally involved in these sort of problems. So you develop a sense of objectivity and look at problem from an outside perspective, not actually get into people's problem. Having empathy in the right quantity is very important, because if you are not empathetic, no patient really likes you. And nobody
Yes.
would want to come back to you because they feel totally ununderstood. So there should be a lot of this sort of emotional connect that you should have with the patient. At the same time, have this sort of objectivity and not get involved. So when you're actually finishing your work and going back, actually there's so many radio channels that comes in. Just listening to them on the way back home, this half-an-hour drive actually helps you to disconnect and go into next template of going back home, and your mindset could really change. So listening to music, pursuing some hobbies, talking to a friend online.
Call, right.
I'm not saying that you must risk yourself when you're driving, but there are Bluetooth and other options available. So doing this sort of unwinding tasks really help. A lot of people do meditation. Even 15-20 minutes of meditation really helps them. Hobbies, I always keep saying, because there are a lot of people who just fall back on hobbies just to unwind themselves.
Yes.
I have a friend of mine who goes back home and does a lot of cooking because he does not want anybody to cook at home, and this cooking really helps him unwind.
Right.
And he's a psychiatrist, he's an excellent cook, so the spouse does not seem to be having a problem at all, because they just wait for him to come back, and he wants to unwind, and the family gets excellent food. So people pick on to different things. I think we need this sort of space, a good half an hour to 45 minutes to unwind. You cannot really change your mindset and say that, I'm sitting on this chair, I'm a psychiatrist here, you exit from your chair and next minute you're a totally different person. It cannot happen that way. You need this sort of buffer space to unwind.
How long did it take for you to get to this space? Because I'm sure when you started practice, it wasn't that easy, no?
I think what happens is when you begin work, you don't have so much of work at hand, and you don't have so many responsibilities. You don't begin with everything on day one. So everything unfolds over a period of time. It could be a few weeks for some people, it could be a few months for some people, or it may take years' time. A lot of people have balance. They work in a corporate hospital or a medical college. This sort of jobs may be less demanding, and they could be more structured. If you're running your own setup and you have a lot of patients, you hardly have control on a lot of work. A lot of walk-in comes in. There'll be hospital administration related issues. There could be a lot of patients' family-related concerns. Managing everyday hospital work can be a huge challenge. So I think each one, depending on the role that they choose, I think the challenges could be entirely different. So it builds over a period of time, and you have good protective resilience factor within you, which tends to stand out and help you to manage and cope up.
Super. So now with the whole mental health awareness, and there's so much focus on this area. Now, for students who are studying this and who are pursuing this, what are some of the avenues that they have once they graduate and they're out of college? What are some of the avenues, and what would your advice be in terms of they wanting to have their own setup? Would you advise, would you be against it? What is your take?
If you look at the mental health needs, there's a huge need. If you look at the recent survey that was done by the government in association with the National Institute of Mental Health, NIMHANS, they say only around 20% of the population who actually need help or on treatment. So there are 80% of the people who are out there in the common spaces, who are there in the world, who need evaluation and treatment process. So all that the psychiatrists in the current country are doing, that is, we are around 10,000 in number for the entire population of this country. So we are just managing and treating less than 20% of the people. So whoever is planning their career in psychiatry, there is a lot of hope, simply because this 80% of population who need help are not being addressed at all. So government's focus is also on putting a psychiatrist at every district that they're really trying hard for the last 3 decades to manage. There's so many states which don't have psychiatrists at all the district level, but Karnataka is fortunate. We have a district at every district seem to have a mental health professional and a psychiatrist at every district here now. So every medical college needs a department. So medical colleges need at least 3 faculties to actually function. So there is a lot of hope, depending on what you want to do. If you want to do medical college related work, there are so many colleges. I think Karnataka is blessed with the highest number of colleges.
Yes.
And our Indian population is so huge, the mental health needs are so different. The current psychiatric population that we are, in terms of the trained mental health manpower, we are 10,000 as against 40,000 needs. So 10,000 psychiatrists are built over a period of last 5 decades. So even if you pursue at the same rate, we may accumulate another 10,000 in the next 5 decades.
Right.
But if you're growing exponentially, if the training pattern changes, if the number of students taking psychiatric can change, this number can be achieved a little earlier. But the needs for the current population is 40,000 psychiatrists. So there's a huge need, there's a huge gap, and the treatment evaluation gap that's happening is 80%. So there's still untapped, people with psychological needs and interventional needs. So there's a lot of hope, depending on your risk appetite and your interest and energy levels. If you want to do a practice of your own, you need to have really high energy levels. You need to have a lot of focus and targets. And it's not very easy to just do practice. If you want a 9-to-5 life, doing private practice is not your arena at all. If you're ready to work 9 to 9, yes, you can really venture into psychiatric private practices, because you'll have outpatients, you may have inpatients at multiple hospitals, you have to keep shuffling between different hospitals. You may have to do a lot of community work sometimes, attending calls, you do video consulting, you do a lot of counseling work also. If you have your own setup, it has administrative needs. So not all of us are geared enough to balance administrative needs versus clinical needs. So if you have those things in you, if you really want to take it up and think like ready to really work a good 10 to 12 hours a day, I think as a beginner, all of us need to contribute this. Otherwise, doing private practice and trying to establish on your own is going to be a huge challenge. It has a lot of other needs, special needs, like infrastructure needs could be different. Yes. You have a licensing need which could be different. You are under constant monitoring of judiciary. You have a separate mental health care act for us, which monitors how a patient has to be admitted, who are the patients who should be discharged, and how they should be treated in the hospital setting. So any violation of rights is a huge thing. So a lot of interface happens with NGOs, police, with judiciary, with family members, media. So all these things can be extremely challenging. You must really be on the toes, really be geared enough to deal with this sort of crisis and manage this.
Wow. Okay, that's a lot of things to deal with.
Yeah.
Right. So I know that there's a lot of service orientation in what you practice today, but at the same time, you're also running an establishment, which is profit making, and there is a business aspect to it also. So how do you deal with this? Because you've studied psychiatry with an intention, and then you're running a business also. So I'm sure there are times when you're torn between the two. So how do you deal with it from an entrepreneurial mindset?
I think if you look at profit as the only motto in sort of work that you do, I think you may be disappointed at times. But if you look at this as a service, you have your margins, but make sure that really people are not really taxed. So that's the philosophy of our hospital that we have done, and this hospital has sustained for the last 6 decades. So that is a testimony for how it is functioning and really works. So actually having huge profit margin and making it expensive or making it unaffordable for patients can be just limiting your sort of patient clientele that you're going to see. Most of the people who don't want to be treated in a government setting or a free setting would like to look at these sort of cost-effective setups. So keeping it really affordable for this huge population, the lower and middle strata is a very huge population.
Yes.
And the challenges here is most of the patients are paying out of their pockets. Insurance doesn't seem to be reimbursing, in spite of having a lot of legislation and direction from the insurance regulators to make sure they reimburse it. The expenditure that the people pay out of their pockets is really huge, and they hardly get reimbursement. I think
so there is no reimbursement for mental illness?
Yeah, as far as the policy and law is concerned, it has to be treated at par with physical illness, but they have a lot of riders, like they say pre-existing illness is not covered, first 4 years you cannot claim for mental illnesses, and even if you claim, some people cap it at 50,000 rupees per hospitalization, so 50,000 hardly is enough for a lot of people. So If they are really paying out of the pocket, you have to keep your services affordable, and that's a huge challenge. You have to deliver excellent results. You have to keep your quality really high, and you have to be update with all the treatment strategies that is there, and make sure it's really affordable. So there are some interventions like modified ECTs, magnetic stimulation, a lot of psychotherapeutic interventions that you do can be unaffordable for a lot of people. So the moment you keep the price high, a lot of services cannot be really afforded. People cannot afford it. So what we have done is we have reduced the profit margin. For us, it's number of patients and volume. I could see 50 patients in a day charging X amount of money, but if I do X minus 25% of my service costs, I can see 70 people. If I do X minus 50%, I would see 80 to 100 people. So for us, it's the number here, and we have a lot of outpatients, a lot of inpatients here. And when some people cannot pay, we should be able to let it go. I don't expect 100% of my patients to pay all my bills. There'll be some people who cannot afford my services. You have to weigh off your costs. If somebody is admitted, they are, they're okay to pay your bills, but over a period of time, they may not have the required resource to pay them. And you have to understand the sort of genuine people who don't have this sort of resources and let go the costs. Even if 95% of the patients pay my costs, I'm really happy. 5% I'm able to let go. I don't want to fret over this 5% not paying, and I think that's how you should be. We pay 30 to 40% of taxes for the government when you think that's a mandate. So you please think that in your services you will see 5% of your patients without cost. So that helps you to distress your targets, and you may not be really harsh on people who are not able to afford your services.
Got it. Now for entrepreneurs or people who medical practitioners who want to have their own setup, what would be your 3 things that your advice, basically 3 things that they should think about before they
I think before really venture into outside world to understand what you really want to do, I think you must taste the waters to see what it looks like. Please work in some sort of teaching institute for some time, in a research institute for some time, work in a private setup, and try and understand the challenges, the needs, and the sort of reserves that you need to have to work in this sort of space. The moment you have understood where you want to work, also try and learn the skill sets. Whatever I learned during my period of training was totally inadequate to manage the current needs of the patients who come in to manage a setup. Nothing of this sort is actually taught in the training itself, because you would learn to diagnose a problem and you would know how to treat a person, but choosing the right patient with the right medications, in terms of costing, all those things really happens only when you're venturing and seeing patients in real life. Nobody teaches you how to open a hospital, how to run a hospital. I don't think it's a part of the curriculum at all. So this is something that has to be in you. Be a passive observer, work in setup, see if you can really stand up to these sort of challenges. You can begin as a group practice, you can do a solo practice. There are flip sides and challenges to everything that you do. Seeing alone in a private practice and doing everything on your own is extremely challenging. People go into burnouts. You don't have any time for family, hobbies, or whatever I'm talking about for mental wellness. I don't think any psychiatrist is going to have it. So working in group, yes, has some disadvantage, but a lot of positives to say that there's somebody to share your workload burden. You have a think tank to really fall back on and troubleshoot certain issues. You can take breaks like 15 days, 1 month, a holiday, which is not possible when you work on your own alone. So there'll be challenges and advantages in everything that you're doing, but we must taste this sort of waters to understand what we like. When you don't know what to do, please look upon to your mentors, seek some sort of advice. If at all somebody wants to start a practice, generally they come and talk to me, spend time with me, because I've done this and I've understood a lot of difficulties, the nuts and bolts of starting, running, and maintaining a center is what I've learned in the last 2.5 decades. So I'm actually open to help people to conceptualize this idea and actually start and run a setup also. So people come and discuss. I'm one of the few who are there in Karnataka, but a lot of people are there in other states and different specialities. There are certain things which is very specific to psychiatry, and the challenges could be very unique. But running a setup on a background of the medical challenges that we have could be similar. But working in a psychiatric setup help you learn a lot of things.
Okay. That brings me to the last question before we wrap up. You've studied medical, and then now today you're a medical practitioner. But as an entrepreneur, what's the biggest lesson you have learned?
I think in my initial days of quest, I believed that I could manage and treat every other person with illness, and I thought that I knew everything, and every other person who did not get recovery, I thought that medicines was the only thing that could have made a difference. So in the last 2.5 decades, I've learned that everything has limitations. To my understanding, to the current medical science and evidences that you have, in terms of intervention that you have, in spite of all the best intervention, there's still a significant population of psychiatric illness who really struggle for complete recovery. You're not able to deliver complete change for a lot of people with the current treatment options we have. So 20 to 30% of people need a lot of extra thinking, a lot of multimodal intervention. You need psychological intervention, you need a social work to intervene, you need an occupational therapist to intervene, you need a person practicing yoga, and all these things has to be holistic. So what I've understood is medicines may not be the only answer to a lot of people's problems. So holistic approach involving a lot of other specialists involved here, and giving this sort of tailor-made solutions to patients becomes important. Textbook can teach you psychiatry and help you manage a lot of illness, but each patient is challenging, and each patient has taught me how unique he could be and what are the challenges that each patient can pose to us. So when you start working, I think you understand, in spite of the best of training, you will have limitations, and each patient is definitely a challenge.
Right. I think while you're working with humans already, like even in human resource, they say that every case is so different, and you're a psychiatrist, I'm sure you've seen an array of cases. So thank you so much for sharing your experience with us. It was invaluable, and thank you so much for coming and spending time with us today.
Thank you, Rasha. I also enjoyed every bit of it. I hope it was useful in some way.
Absolutely.
This discussion could reach a lot of people who aspire to do this sort of mental health services, and understanding illness and having this sort of solutions could be a way forward for a lot of people.
Yes, thank you so much.
Thank you.